Do you struggle to understand how the NCLEX is asking you? Do you know how the chapter correlates with this NCLEX by in order to pass your NCLEX? Do you want to practice NCLEX questions using this chapter as a guide? In this chapter, I present patients with skin disorder. Hi friends, I'm Nurse Mia. Welcome back to my channel and to part 3 of the Med-Surg RN chapter, NCLEX review in the Zen RN study group series. In this video, we are breaking down the 15 NCLEX clinical judgment domains and showing exactly how they connect to the Med-Surg chapter you are already studying. We will walk through each one step by step so you can finally see how NCLEX thinks and how to answer them. If you are being overwhelmed and unsure what the NCLEX really wants from you, this might be the missing piece. In chapter 50 for the NCLEX, coordinating care for patients with skin disorders, NCLEX style question. Before we start into the details, I would like to show you what this chapter is talking about. So this chapter, in case you didn't watch the outline, I will make a very quick introduction. So this chapter is very heavy, has like 8 diseases regarding skin issues. I found in the internet these 2 nice pictures about how the bacteria infection the infection is, and here it's cancer. I have also like more other ones, but the internet it's full of those type of pictures in case you want to get more into it. And I think nowadays everybody knows how to search for anything, even if you ask AI. I focus from Davis Advantage Medical Surgical edition 3. So I'm reading there and I do these outlines based on how the book edition 3 is made. Is no AI involved in these notes because they are my personal notes after I read the chapter. So about 6 months ago, I read this chapter, and I had my notes since then, and then somehow I decided to share with many people because I have some classmates that liked my notes. So I thought like up there in the world might be some people that students that might really want a review exactly 100% from the book. These 2 pictures, they're from internet. I always say always, but this it's made by me, typed. I made and I use Microsoft PowerPoint, Word, and Excel, and they have nice. It's an application there inside that can help you to make those nice hierarchy, they call it hierarchy chart. Then so this chapter, my strategy to pass NCLEX, I take each chapter as is the only thing the NCLEX will ask me. So I will imagine that this chapter I need to pass the NCLEX, so I have to make the most of it. And since we have the 8 diseases, bacterial skin infection, herpes, simplex virus, fungal infection, cysts, skin trauma, pressure injuries, skin cancer, and reconstructive surgery. In the chapter, we talk a lot about the bacteria, skin infection, MRSA, and that. It also, it's repetitive from the chapter with infection immunity. In that unit, it's repetitive, and here and there is repetitive for here. With cancer, here it's repetitive from the chapter with cancer, so that you will find the notes from these two. And I just want to say that I feel very sorry that up in the world there are candidates that failed the NCLEX. I feel very sad, but they are students that passing, and not sometimes some they don't, but it's okay. It's nothing that we just move forward, and we take each day at a time and each chapter at a time. So that's why I make these videos for students to kind of have a boost, to don't get overwhelmed and doesn't know what to do. And I know people talk about they go with this company, they go with that company, and guarantee. Well, everybody has different style. I like some videos in YouTube, but mostly um, I follow people that I like their voices. So if somebody likes my voice, might be some people that likes my voice, some people thinks that, oh, I barely say a word, then it is what it is. We are all opinionated, from opinionated. So the NCLEX is broken in 15 specific domains. I call it here domains. You're gonna always hear me saying domains. They call it subcategories, but I call them domains. And I don't know why, but this I'm saying all the time, domains. And it's about knowing how to apply in different situations. And those domains include the traditional, here the traditional one, the aid. Here is the traditional aid. And also they have subcategories here, you see. And plus 6 steps of clinical judgment. It's right here at the bottom, which is a huge focus in the new exam. By organizing your notes, let's assume that chapter 50 is only and the only one that it's tested. So that's why we want to make sure how we make this pie, how we make a green light for this all based on this chapter. So if we focus like each one, and we understand how the question is made from each individual domain, all these 15, then later in real exam you will kind of pop up say, oh, I kind of know this question, I kind of not remember, but somehow I kind of know. And me, by explaining now, it's another cue that I gain information and to present this. I use this technique when I did my LVN, and I passed with 88 questions in the first try. and it was years ago, and I was new in this country, but I was younger and my brain was much better um, to accumulate new information, but on the same time, new with the language, new with the culture, new with everything. So it's kind of 50-50. Now I know kind of more of the language, but I don't trust my brain. But I trust my brain. But this was my techniques that I'm showing you now. And even if I use ATI at a time, this year I used and use Kaplan. Internet is full of new videos all the time. Now AI can explain you, but depending on edition. And here I say depending of edition with the book and internet and AI, because um, when those books they are made exactly, they publish the books when NCLEX publish a new NCLEX. So the publisher of a book will publish on that era when it's a new exam, because they know how it's going to help a student to get the most of it. So that's why I say I do edition 3, but I think next year when NCLEX 2026 is changed end of March, and I'm gonna download their booklet because this is online and this is from their website, so it's not made by me, it's made by the NCLEX. It's I didn't ask no AI for this, so it's 100% accurate this, so it's no lie on this, and neither on this because it was in Facebook. So I took a show screen sometimes in, I think was beginning of June, I think 12th of June, I remember, and it took me about 2 weeks to think about it, and then in July I start making those videos. Even my channel, I have two channels. One that is my main, that I have for a long time, 2009 I think. And another one it's new because I have a new email address. So I made it, this where you guys see now, I made it last year, but I didn't do no videos, no nothing. I just nothing. Probably that's why my struggles now at the beginning, the analytics in YouTube, because it's been like 1 year no activity on the channel, and probably that's why. Then so think when you make the connection of recognizing the cues is exactly, imagine each disease that what clinical manifestation are observed in this patient. So that is the recognizing cue, and analyzing the cue, it's how the clinical manifestation correlate with the underlying pathophysiology. And prioritizing hypothesis is what could happen if these patient symptoms are not effectively managed. Generating solution, what treatments are included to manage this patient condition. Taking action, what are the priority intervention for this patient. Evaluating outcomes, what findings demonstrate that the treatment plan is effective. So what follow-up data are needed. So think about that, it's in NCLEX, and you see here management of care, it's a big percentage here, it's a big pie, followed by psychosocial adaptation. So health promotion is a little bit, but be careful because you need green light. basic care and comfort, also it's small, and this person here, it was below. So if it's 9%, so probably got 9 questions. Maybe let's say not 9 questions, maybe had 5 questions, and all of them could not pass. Maybe did 1 question from 5 questions, something like that. Probably that is the ratio. You see, 19 to 20, 13, 19, it's pharmacological. So yeah, I think here for pharmacological, it's all about skin medication, the topical one. Because you think about skin, so, but also if it's too infected, you get oral, right? But also it's all those ointments. For here in this chapter, even if they have a lot of diseases, I think cancer and pressure ulcers and with contact isolation for MRSA, I think these are the big keys always in NCLEX and in the nurse life. So now I will show you my 15 domains that, so all these, my 15 domains with examples from this chapter. So each of them I make an example like, and you can make your own kind of question. So let's move and you'll know what I'm talking about. You see, we are in NCLEX, my domains, my 15, and I have few little things like what to do, right? Nursing action, the red flags, priorities, and what kind of tools to memorize. And look, the management of care, you have the burden scale. In chapter 49, in this one, they do documentation protocols. So it's for pressure ulcer, pressure injuries. So that yeah, you need to identify the misidentifying wound stages or delegating wound assessment, because it's management of care, like what the RN has to do with her practice. It's like leadership here kind of thing. So it's kind of leadership. So prioritize wound care, pressure injuries, then the safety, use PPE, monitor infection signs, redness, warmth, drainage, conduct precaution for MRSA, wound culture. So think when you do the NCLEX, like in the new gen, they have case studies and or clinical scenarios, and they have these 6 steps and a lot of questions, and they tell you about clinical data. So even if you are in the same case, it says like, okay, the next day, and like each question, and you have to read. So it's basically like having a patient. So they say take these case scenarios. And I'm most of it when I start doing those stimulation, I really do good because I'm focusing not to get a good grade. I'm focusing to, I see the scenario, I see what's going on, and I see the data, I see the vital signs, and I think 80% of those complications of questions I did very well, but in Davis it's very, I call it stingy. Ah. So if you do a mistake in select of the apply, one only, and if you have like 6 choices to choose and one you did a mistake, the whole question it's mistaken, even if you did. But in NCLEX, not. They give you credit, little points for what you answer. It's not like it's taking away all your credit, so which is nice, it's fair. I think it's much better like that. Health promotion and maintenance, like educate on skin cancer and prevention, and the ABCDE. We talked in the key terms in previous episode. We all talk about ABCDE and sunscreen. The psychosocial integrity, support body image, like for surgical scars and therapeutic communication, will be a question, mix and match, management of care with this one. And then if you it will be select of the apply, and you might did good for this but not on good on this, or maybe you did good on this therapeutic communication, but you let the aid to talk about it, so that it's not good. As an RN, you need to talk. Then basic care, like it's very important right nowadays that many students have this problem with basic care and comfort. It says fragment repositioning, pressure release, hygiene, moisturizing. Like while I'm doing this videos, since I see that basic comfort, it like many candidates has this problem, I'm focusing so much on this. I get obsessed with this, and I want to understand like what was so tricky that some candidates had it and could not pass NCLEX because of this domain, Reposition, I think everybody knows this. Elevate the heels, use barrier creams. Pharmacological, administer antibiotic, topical steroids, analgesics per order. Monitor side effects. Yeah, you don't want more skin rash or something. Double dosing or skipping topical therapies. You see red flags. Topical meds protocol, signs of allergic reaction. Psychosocial adaptation, which is also one of the important one. Manage wounds, monitor for systemic infection and septics. So you see in immunity and previous chapter, so there are 3 chapters that they focus on the same, like monitor for systemic infection or septics, ignoring signs of hypovolemia or fever in open wounds. Signs of symptoms of a sepsis, fever, hypotension, tachycardia. So basically, I think it's a big deal if a student will miss the infection. And I want to tell you that I had quizzes where in select all of the apply, and one of the correct answer was the temperature or something, and for some reason I didn't click that, so I missed in that question because of the fever. And I said like 100 little bit might not be that so difficult, like I need to focus on this more. No, infection. So infection, I think many instructors, when they put in the question infection as a multiple choices, that's correct answer. I think they know that NCLEX will ask for infection like temperature and all these signs of septics, and fever, hypotension, hypovolemia, tachycardia. So those keywords and what means for the patient actually will lead you, either you pass NCLEX or you not. So keep that in mind. I mean, we're not gonna hurt you if you keep that in mind, an extra. Yeah, because I don't have so many. Uh, let's say treating all wounds the same without reassessment. So I'm rereading my notes that I did actually in, I think this was in April. So this I did in April in 2025, and today it's October. So it's been a long time since, and for me, while I'm doing this, um, I know it because I went through it, but it's like I'm seeing my what I did. So sometimes I'm amazed. I give you my self uh, um, evaluation. Analyze cues. Link fever, drainage, elevate white blood cells, wound infection. Insane. Fragmented data interpretation. Fragmented, not fragment. I don't know. I see an F word and I just make up a word now. CBC trends compared to baseline. This we know. Wound classification chart, wound care protocols, follow-up facility protocols, document percentage improvement. And in the previous chapter and in this chapter, I have to repeat again, if somebody has stage 4 pressure ulcer, when you document, even if it's almost a little dot from that pressure ulcer, it's still, let's say a patient had came in with pressure ulcer 3 or 4 or unstageable, then when it's even a dot, you don't say pressure ulcer uh, 1 or 2. No, you say same, unstageable. So because if you say different stage, then Medicare or the insurance will think that a patient has another um, another wound. But when you document, it's like stage 4 or stage 3, but today the size, it's 5 centimeters, but in documentation was probably 10 or 20. Now it's 5 centimeters, and you describe how the wound is. So even if it's almost healing, the insurance wants to um, know what is, and also in medical. So especially Medicare wants to know what happened to that stage 4 pressure injury. Did it got better or not, or we just hope for the best? So you cannot put a different name. So that I said, implement barrier creamers, schedule turns and apply dressing. This we know. Create care plans. Yeah, let's go on the other one where it's more tricky. Here we have the same, the pie the pie that I always talk. Basic care and comfort. You see, I think I make you know, guys, that I'm getting obsessed with this. So it's skin hygiene, moisture control, turning and repositioning, supersurface. Select nursing action to maintain skin integrity. So basically in skincare comfort, select nursing action to maintain skin integrity. So think you have this patient. So choosing a non-specific or outdated intervention like a baby powder use. Yeah, we use a lot of silver sulfur design. Confusing fungal versus bacterial. Again, you see phases of wound healing. Educate on UV protection. Choose correct PPE as isolate a high-risk patient, identify sepsis. So in here it's MRSA and herpes. Yes, droplet precaution, mixing contact precaution with droplet precaution. It's very common. So now let's go into, I have 10 questions. Let's go into each of these, how we play. I make an example of a question of all of these to see how NCLEX, we assume that these 10 questions, it's all about our pie to pass. So let's go into. You see here, question 1, domain, safety and infection control. A nurse is caring for a patient with cellulitis on the lower leg. Which action should the nurse perform first? Apply a warm compress to the affected area. Evaluate the affected leg above heart level. Obtain a wound culture before starting antibiotics. Administer prescribe analgesic for pain. So yes, you need wound culture before starting antibiotics. And obtaining a wound culture prior initiating antibiotic therapy ensure accurate identification of the organism, like what it is. You know, maybe a patient is resistant to some antibiotics because this patient has certain bacteria that will not be effective. Intervention like compress and elevation are supportive, but should follow the collection culture, because it says like first. What do you do first? What do you do first? Domain, health promotion and maintenance. The nurse provides teaching to a client with actinic keratosis. Which statement by the client indicates understanding of condition? So it's a health promotion and maintenance. Those patches mean I'm dehydrated. This condition can develop into skin cancer. It will go away on its own without treatment. This is caused by an allergy to sunscreen. So this condition can develop into skin cancer. So why? Because we know this actinic keratosis, it's a keyword that I said in key terminology. Many students skip that, but it's very important because if you don't know what this means, you are fishing here. You're just fishing what is the correct answer. You might get confused with this one, or maybe with the A you might get. So the actinic keratosis is a pre-malignant lesion that can progress to squamous cell carcinoma if not treated. Domain reduction of risk potential, which finding requires immediate intervention in a client with a pressure injury. Foul smelling drainage from the wound, erythema around the wound margin, serous drainage with a slight tenderness, warm skin around site. Again, about this, it's talking in the key terms about the stages. This is another keyword, this also. So that I explain in key terms. So the foul smelling drainage from the wound. Foul smelling drainage suggests possible infection. So the foul smelling is like the odor, possible infection or necrosis. This requires prompt attention to prevent sepsis. Domain, psychosocial adaptation, which is very important for the NCLEX. A nurse is assessing a wound with yellow, slough, and minimal drainage. Which dressing is the most appropriate? Transparent film, hydrocolloid dressing, dry sterile gauze, alginate dressing. Hydrocolloid dressing. So why do you think that? Supports autolytic debridement and are effective for wounds with slough and minimal to moderate drainage. For commercial insurance, for people that doesn't use Medicare, it's very important when you buy those supplies. As a nurses, we need to be aware of how patient they use supplies, and to be mindful that we know what to order for the patient, and we don't have to call the doctor to ask what dressing I should use for the patient, unless the doctor says like, no, don't use that, use that. Okay, then and with Medicare, then will be the home health that some they have to ask Medicare for the supplies. So there also it's kind of what and how and which dressing they use. So it's also money here, and also the dressing, what is better for the patient as well. Domain, pharmacological and parental therapies. A patient with a skin infection is prescribed vancomycin IV, not IV. What should the nurse monitor closely? Heart rate and rate, urine output and keratin level, hemoglobin and hematocrit, electrolyte panel, and glucose. So skin infection, and we have this. Urine output and keratin, because vancomycin is nephrotoxic. Monitor kidney function through urine output, and keratin is essential. So you see it's kidney function, the key here. Domain management of care, like a kind of leadership of nursing of an RN, which action best reflects effective delegation. Here you go, this delegation to unlicensed assistive personnel, the CNA, caring for a patient or caregiver, caring for a client with pressure injury. CNA applies a dressing to the wound. CNA assesses the wound size and drainage. CNA reports a change in wound odor to the nurse. The CNA teaches the clients to reposition every 2 hours. So think what is RN. So what is RN? And then the CNA. This is my mouse. So no nice. So think best reflects. So CNA reports a change in odor to the nurse because can report observation but not assessment, teaching, and wound care. It's outside of their scope of practice. So that is the domain management of care, and you see it's delegation. So it's leadership. Domain safety and infection control. The nurse is reviewing a skin biopsy. Okay, the nurse is reviewing a skin biopsy results for a client diagnosed with melanoma. Okay, we know what is this, right? Which finding is most concerning? Asymmetrical lesion with irregular border. Think what means melanoma and how kind of looks like. Elevated mole with even pigmentation. Lesion smaller than 6 millimeters in diameter, smooth dome-shaped growth on the face. So this in chapter 49, in the previous chapter, when it was the anatomy, physiology of the skin and some complication, age-related complication, yeah, diagnostics, and nursing implementation. What I do, I was saying about like how in the quizzes, finals, and NCLEX will ask you, especially in quizzes, if they say like this, exactly this, like they describe you the definition, and now you need to know the key term. That's why I say if you know this, you already know which how this look like and who are those here. So correct answer is asymmetrical lesions with irregular borders. Domain, health promotion and maintenance. Which teaching is most important to include in a client prescribed isotretinoin, the Accutane, for severe acne. So this is a severe acne. Here it's a medication. And most important, so teaching. Avoid spicy foods during the treatment. It's not a GI problem, right? Use additional birth control methods. Apply medication only on affected area. Avoid all physical activity for 2 weeks. Why you need to avoid physical activity for 2 weeks? Use additional birth control because this medication, isotretinoin, is highly teratogenic. So strict birth control measures are essential during therapy. There are other ones that say you needs to be aware of this, but that it's in different chapter, different story, different. I keep it for other time. 9, question 9, domain psychosocial integrity. A client with psoriasis expresses embarrassment about their skin appearance. So you see skin appearance, like how the person appear. What is the nurse best response? Most people won't notice your condition. Try to wear long sleeves to cover it. Psoriasis is not contagious, so can be managed. You should see a counselor about your concerns. Psoriasis is not contagious and can be managed. The nurse should educate the client factually and support their self-esteem without diminishing their feelings. Yeah, we don't go more like, oh, you should see a counselor about your concerns. So basically, the patient asking you something and you say, oh, you go to this person, and try to wear long sleeves to cover it. Like, why you say that? You need to explain more because that the patient will do anyway. They want something else. Most people will notice your condition. No, it's like ignoring. So this sometimes this type of questions, domain, psychosocial integrity. Also, when you talk to a client teaching or best response, when they say this, it's mostly like you teach a pathophysiology of that disease. The last question, domain, basic care and comfort. What is the priority nursing intervention? So what is the priority nursing intervention for client with pruritus related to eczema? So here is eczema and priority nursing intervention. So, like ADPI, nursing, they do ADPI like assessment, diagnosis, P-planning, and then you do the intervention, and then you evaluate. So what do you do about it? Maintain warm, humid environment, encourage frequent hot showers, apply prescribed emollients after bathing, instruct to avoid all sun exposure. About this, I can say in the previous chapter about when you apply emollients after bathing, because in previous chapter was the assessment, and then there were with complication, patient teaching. It had a lot of in depth, but in this chapter is a little bit repetitive. But I think repeating it's will memorize. Emollients help maintain skin hydration and reduce itching. Applying after bath locks the moisture. So that's it. I had my 15 domains explaining my questions, and I had my 15 domains with their definitions and examples and how NCLEX work. And I hope this question style it made a bit easier to follow, easier to understand, but your success can be different, and effort, also your effort on this. This is just a little review. You are responsible to look more in the book, not to look on the internet and searching. It's good, but to get info, look on your books, your newest edition, and follow that guidance. And that's it for today. Thank you, and see you in the next chapter. Will be about burns. Oh wow, that is a huge chapter. It's huge. Okay, thank you, and bye for now.
We finally made it!
Thank you again for your time and trust. I'm Mia, and from my heart to yours. Until next time, stay zen, stay grounded. Namaste. Bye for now.